Imagine waking up in a world where the very air you breathe could kill you, where the cure for illness might be worse than the disease itself, and where medical knowledge was a curious blend of ancient superstition and dangerous experimentation. You're about to discover what it truly meant to fall ill in the grimy, smoky streets of Victorian London in the 1840s. The year is 1847. Queen Victoria has been on the throne for a decade, but her reign of progress hasn't yet reached the cramped tenements of the East End. Here, in these narrow, cobbled streets where you now find yourself, illness isn't just an inconvenience, it's a journey into a world of bizarre remedies, questionable medical practices and treatments that would make modern doctors faint. What if you woke up tomorrow with nothing more than a simple, sore throat, but found yourself trapped in an era where bloodletting was considered cutting-edge medicine, where mercury was prescribed as readily as aspirin, and where the very act of seeking help might prove more dangerous than the illness itself? Before we dive into this peculiar world of Victorian medicine, if you're enjoying this journey back in time, why not let others discover these fascinating historical adventures too? A simple like, share, or comment helps other history lovers find their way to these stories, and if you subscribe, you'll never miss another trip through time. But for now, let yourself settle back, close your eyes, and prepare to experience firsthand the strange, often absurd, yet surprisingly human world of being unwell in Victorian London. Your adventure in medical history is about to begin. You stir slowly from an uneasy sleep, your consciousness drifting back to you like smoke through the grimy window of your small room. The morning light, if you can call it that, filters weakly through glass, so thick with soot that it might as well be made of brown paper. You're lying on a narrow bed with a straw mattress that crackles softly beneath you as you shift, trying to shake off the heaviness in your limbs. Your throat feels raw as if you've been breathing sand all night, which in a way you have. The air in this part of London carries more than oxygen. It carries the detritus of 1,000 coal fires, the dust of industry, and the general miasma of a city growing faster than its ability to stay clean. You swallow, and the simple action sends a sharp pain down your throat. Your body feels warm uncomfortably, so despite the October chill that seeps through the thin walls of your lodging house, the fever hasn't declared itself fully yet, but you can feel it lurking at the edges of your awareness like a cat preparing to pounce. Outside your window, the sounds of Victorian London are already beginning their daily symphony. The clip-clop of horse hooves on cobblestones creates a steady rhythm punctuated by the occasional shout of a street vendor. Fresh bread. Still warm, calls one voice. Milk? Fresh milk, calls another, though you suspect the definition of fresh might be rather generous in this neighborhood. You sit up slowly, your head spinning slightly with the movement. Through the thin walls, you can hear Mrs. Pemberton in the next room, beginning her daily ritual of violent coughing, a sound that has become as reliable as church bells and far less pleasant. Her persistent chest ailment has been with her for months now, but she continues working at the match factory nonetheless. In 1847, staying home sick is a luxury most cannot afford. The floorboards are cold against your bare feet as you pad to the wash basin in the corner. The water in the ceramic pitcher is icy, having been drawn from the communal pump in the courtyard yesterday evening. As you splash it on your face, the shock of the cold makes you gasp, which triggers another painful swallow. Yes, there's definitely something wrong with your throat. You dress slowly in your day clothes, a rough wool shirt, woolen trousers that have seen better years, and a vest that once belonged to someone considerably larger than yourself. The clothes smell faintly of the coal smoke that permeates everything in this part of London, Even your freshly washed linens carry the scent within hours of hanging on the line. As you button your shirt, you notice your hands are slightly unsteady. The fever is definitely building now, creating that peculiar floating sensation that makes everything feel slightly disconnected from reality. You tell yourself it's nothing, just a minor cold that will pass with a day or two of rest. After all, what could go wrong with such a simple ailment if only you knew what the next few days would bring? You make your way downstairs to the communal kitchen, each step echoing hollowly in the narrow stairwell. The building houses 12 families in what was once a single-family home, and the conversion shows in every creaking board and hastily constructed partition wall. Mrs. Henderson is already at the stove, stirring a pot of what might charitably be called porridge. She's a woman in her 50s with silver hair pulled back in a severe bun, and the kind of practical wisdom that comes from raising 6 children in conditions that would challenge a saint. When she sees you enter, her experienced eye immediately catalogues your symptoms. "You look peaky, love," she says not unkindly. "Throat bothering you," you nod, not trusting your voice to emerge without betraying the extent of your discomfort. "Ah, I thought so. You've got that look about you, the same one my Tommy had last month before his chest went bad." She continues stirring the porridge with one hand while reaching for a small brown bottle with the other. "Here's what you need: gin. 2 fingers of gin with a bit of honey, and you'll be right as rain by evening." She pours a generous measure of clear liquid into a tin cup and adds a spoonful of honey from a pot that's seen better days. The gin burns your throat even more, but Mrs. Henderson watches expectantly, so you manage to swallow it with what you hope passes for gratitude. "There's a good lad," she says approvingly. "Gin kills everything it touches: germs, pain, and occasionally people, but mostly germs." She laughs at her own joke, a sound like paper rustling. As you're recovering from the gin, young Tommy Henderson comes clattering down the stairs. He's perhaps 16, with the kind of boundless energy that only the young possess, even in the face of poverty and poor nutrition. His face lights up when he sees you, nursing the cup of medicinal gin. "Oh, you're trying Mum's cure, are you?" He grins, revealing teeth that are surprisingly white for someone in his circumstances. "Wait until you hear what old Mr. Wickham upstairs recommends for throat troubles." As if summoned by the mention of his name, Mr. Wickham appears in the doorway. He's a rail-thin man of indeterminate age with wild grey hair and the intense eyes of someone who has strong opinions about everything. He takes one look at you and nods knowingly. "Gin is it," he snorts dismissively. "Waste of good spirits, that is. No, what you need, young fellow, is to breathe in more coal smoke. Stand right by the chimney when the wind's blowing it down and breathe deeply. The heat and the particles will burn the sickness right out of your throat." Mrs. Henderson rolls her eyes. "Don't listen to him, love. He also thinks eating raw onions prevents cholera." "It does," Mr. Wickham insists, his voice rising to match his conviction. "The smell alone keeps the bad air away." "And coal smoke, why, it's like having a constant fire in your chest, burning out all the corruption." Tommy leans closer to you conspiratorially. "Last month, he told Mrs. Collins that walking backwards for an hour each day would cure her rheumatism. She tried it and fell into the street just as the rag and bone man was coming through with his cart." You find yourself smiling, despite your discomfort. There's something oddly comforting about this everyday banter, this community of people who look out for each other in their own peculiar ways. Even if their medical advice might be questionable, their intentions are clearly good. Mrs. Henderson refills your cup with more porridge. "Don't mind us, dear. We all mean well, even if we don't always know well. The truth is, most of us haven't seen a proper doctor in years." We make do with what we know, and what we know mostly comes from our mothers who learned it from their mothers, going back to when medicine was more prayer than science.
Not that science has improved things much, Mr. Wickham mutters. Last time I saw a doctor, he wanted to put leeches on my forehead for a headache. Leeches, as if blood-sucking creatures could cure anything that bloodletting couldn't make worse. As you sip the porridge, which tastes exactly as grey as it looks, you realise that you've stumbled into what passes for medical consultation in this world, a combination of folk wisdom, desperate experimentation, and hopeful optimism. It occurs to you that in this era, before the discovery of germs or the development of effective medicines, being sick means navigating a maze of well-meaning but potentially dangerous advice. Your throat still hurts and the fever seems to be settling in more firmly, but the warmth of human concern around you provides its own kind of comfort. These people may not know how to cure you, but they're willing to try, and in 1847 London, that kind of community caring might be the most powerful medicine available.
By midday, your fever has progressed from a vague warmth to a more insistent heat that makes your head feel as though it's wrapped in wool. Mrs. Henderson, noting your increasing pallor and the way you've been holding your throat, has made a decision that fills you with both relief and apprehension. I've sent Tommy to fetch Dr. Blackwell, she announces, bustling around the kitchen with the determined efficiency of a woman who has nursed many family members through various ailments. He's not the cheapest, mind you, but he's got proper credentials from the Royal College, and he doesn't smell of gin during his consultations. The wait feels interminable. You find yourself dozing fitfully in the chair by the small fire, drifting in and out of fever dreams, where the sounds of the street outside become a strange symphony of hoofbeats and voices calling incomprehensible words. When you wake, the light outside has shifted, and there's a new presence in the room, a doctor. Blackwell is exactly what you might expect a Victorian physician to look like, as if he's stepped directly from a medical textbook of the era. He's a man in his 50s with a magnificent moustache that seems to have a personality of its own, waxed to precise points that quiver slightly when he speaks. His black frock coat is impeccably tailored, and he carries a leather medical bag that has seen enough use to suggest genuine experience without appearing shabby. Mrs. Henderson, he says, his voice carrying the authority of education and social position, I understand we have a patient requiring attention. His eyes fall on you with the practiced assessment of someone who has seen numerous ailments. You notice he maintains a careful distance in an era before germ theory. Doctors still believe that disease spreads through miasma or bad air, and proximity to illness is considered potentially dangerous. Stand up, if you please, Doctor. Blackwell instructs, setting his bag on the table with a soft leather thump. Let me observe your general constitution. You rise unsteadily, and immediately his moustache twitches with what might be concern or professional interest. Ah yes, I can see the fevered aspect immediately. The skin tone, the slightly glazed expression, classic presentation of what we call a putrid throat. He opens his bag and you catch a glimpse of instruments that look more suited to carpentry than medicine. There are metal devices with sharp edges, small glass vials containing various coloured liquids, and what appears to be a collection of primitive syringes. Now then, Dr. Blackwell continues, pulling on white cotton gloves. The treatment for such conditions is well established by medical science. We must first reduce the corruption in the blood that is causing this fever, and then address the local inflammation in the throat. Mrs. Henderson hovers nearby, wringing her hands. Doctor, he's been getting worse since morning. The gin didn't seem to help much. Dr. Blackwell's moustache practically bristles with professional disdain. Gin. My dear woman, while alcohol has its place in certain medicinal applications, what this young man requires is proper medical intervention. We shall begin with therapeutic bleeding to reduce the fever and remove the corrupted humours. Your blood feels like it turns to ice despite your fever. Bloodletting. You've heard of this practice. Of course, it's the standard treatment for virtually every ailment in 1847. The theory dating back to ancient Greece holds that illness is caused by an imbalance of the four humours in the body: blood phlegm, yellow bile, and black bile. Too much blood, and you become feverish and agitated. The solution, therefore, is to remove some blood to restore balance. It's really just a sore throat. You manage to croak your voice barely above a whisper. Doctor Blackwell fixes you with a stern look that suggests questioning medical authority is both foolish and potentially dangerous. Young man, I have been practicing medicine for 23 years. I trained at Guy's Hospital, and I have treated conditions ranging from consumption to brain fever. A simple sore throat left untreated can progress to quinsy, then to putrid fever, and finally to complete systemic collapse. He begins removing instruments from his bag with practiced efficiency. We shall begin with moderate bleeding. Perhaps 8 to 10 ounces should suffice for a person of your constitution. Then we shall apply a mercurial preparation to address the local inflammation. Your head spins, and not just from the fever. The casual way he discusses removing a significant portion of your blood, combined with the mention of mercury, which you suspect might not be entirely healthy, makes you wonder if the cure might indeed prove worse than the disease. But this is 1847, and Dr. Blackwell represents the pinnacle of medical knowledge. His confidence is absolute, his methods are standard practice, and his authority is unquestionable. As he prepares his instruments, you realize you're about to experience firsthand why surviving illness in Victorian London required as much luck as medical intervention. Dr. Blackwell arranges his instruments with the methodical precision of a craftsman. The centerpiece of his preparations is a device that looks disturbingly like a small, sharp knife, which you realize with growing unease is exactly what it is. Beside it, he places a ceramic bowl decorated with blue flowers, as if the cheerful pattern might somehow make the procedure more pleasant. "Roll up your sleeve, if you please," the doctor instructs, his tone brisk and professional. "The left arm will do nicely." As you comply, you notice that your hand is trembling slightly. Whether this is from fever or apprehension, you're not entirely sure. Dr. Blackwell observes this with apparent satisfaction. "Excellent. The tremor indicates that the corrupted blood is eager to escape. The body knows what it needs, you see." He ties a leather strap around your upper arm, pulling it tight enough to make your hand tingle. This will encourage the blood to flow more freely. Mrs. Henderson busies herself at the stove, but you can see her stealing glances in your direction. Her experience with Dr. Blackwell's methods is evidently enough to make her nervous on your behalf. "Now then," Dr. Blackwell continues, taking up the sharp instrument, a lancet he calls it, and examining its edge with professional appreciation. You may feel a brief discomfort, but the relief that follows will be considerable. I've seen patients' fevers break within minutes of proper bleeding. The lancet is smaller than you expected, but sharp enough that it gleams in the dim light from the window. Dr. Blackwell positions it over a prominent vein in your forearm, pausing to locate the optimal spot with the confidence of long practice. "Deep breath now," he instructs. The cut is quick and surprisingly painless, little more than a bright sting like a particularly aggressive wasp. But the blood that begins to flow is shockingly red and seems far too precious to be draining into a decorative bowl. "Ah, splendid," Dr. Blackwell murmurs, watching the steady stream with evident satisfaction. "Look at that colour, quite dark, you see. that indicates the presence of corrupted humours. As we remove this tainted blood, your body will naturally replace it with healthy, properly balanced blood. You watch somewhat hypnotized as your blood, which looks perfectly normal to you, fills the bowl drop by drop. The sound it makes is soft, almost musical, like gentle rain on a roof. Dr. Blackwell maintains a running commentary on the procedure, his tone that of a teacher instructing a student. The theory of therapeutic bleeding dates back to Hippocrates himself. He explains adjusting the position of your arm slightly to maintain the flow. The ancient physicians understood what modern science has confirmed, that many ailments result from plethora, an excess of blood that creates pressure within the system. As the minutes pass, you begin to feel lightheaded, though whether this is from the blood loss or the fever you can't tell. The room seems to have taken on a slightly dreamlike quality, and Dr. Blackwell's voice sounds as though it's coming from a greater distance than his physical position would suggest. How much? You begin to ask, but your voice sounds strange to your own ears. We're approaching 8 ounces now, Dr. Blackwell replies cheerfully. Nearly finished. You can see how the colour is already beginning to brighten, a sure sign that we're approaching the healthy blood beneath. Mrs. Henderson approaches with a cup of weak tea, her face creased with concern. Doctor, he's looking rather pale. Perfectly normal, Dr. Blackwell assures her. The pallor indicates that the fever is breaking. Soon the corrupted blood will be removed and the body's natural healing mechanisms can take over. Finally, after what feels like hours, but is probably only 15 minutes, Dr. Blackwell places a clean cloth over the cut and applies pressure. There we are, a most successful bleeding, 8.5 ounces of thoroughly corrupted blood removed. He holds up the bowl for your inspection, though the sight of it makes you feel queasy. To your eyes, it looks like perfectly ordinary blood, but Dr. Blackwell points out subtle variations in colour that apparently indicate different types of corruption. The darker portions here, he says, swirling the bowl slightly, represent the putrid elements that were causing your fever, and these lighter areas show where healthy blood was beginning to emerge. As he bandages your arm with strips of clean linen, you realize that you feel significantly worse than when the procedure began. The room spins gently when you move your head, and your throat, which was the original problem, feels exactly the same as before. The immediate effects may seem paradoxical. Dr. Blackwell explains, noting your expression. You may feel temporarily weakened as your body adjusts to its new, healthier state. This is entirely normal and should resolve within a day or two. He begins packing his instruments away with obvious satisfaction. Now, for the local treatment of the throat inflammation, I shall prepare a mercurial solution that will address the remaining corruption. Your heart sinks as you realize that the bloodletting was merely the first part of Dr. Blackwell's therapeutic approach. Victorian medicine, you're learning, believes firmly in the principle that if one treatment is good, several treatments must be better. Dr. Blackwell produces a small glass vial from his bag, handling it with the reverence usually reserved for sacred objects. The liquid inside is a silvery metallic substance that seems to move with a life of its own when he tilts the bottle. Mercury, he announces with evident pride, is one of our most powerful medicinal substances. The ancient alchemists called it quicksilver, recognizing its almost magical properties. Modern medical science has confirmed its effectiveness against a wide range of ailments. You watch fascinated despite your growing apprehension as the mercury flows like liquid metal around the inside of the vial. It's undeniably beautiful, with an almost hypnotic quality that makes it difficult to look away. The principle is quite simple. Dr. Blackwell continues, measuring a carefully calculated portion into a spoon. Mercury has the unique ability to bind with the corrupt humours in the body and neutralize their harmful effects. It's particularly effective against putrid conditions of the throat and chest. Mrs. Henderson hovers nearby, her expression suggesting that she's witnessed this treatment before and has mixed feelings about its efficacy. Doctor, last time you gave mercury to young Sally from upstairs, she complained of her mouth feeling strange for weeks afterward. Dr. Blackwell waves dismissively. Temporary side effects are common with powerful medicines. A slight metallic taste or tender gums simply indicate that the mercury is working to eliminate the corruption. Sally recovered completely, did she not? Well, yes, Mrs. Henderson admits reluctantly, though she did lose 3 teeth shortly afterward. Coincidental, Dr. Blackwell states firmly. Tooth loss is common among the working classes due to poor nutrition and inadequate dental hygiene. The mercury had nothing to do with it. He adds a small amount of honey to the spoon, creating a mixture that looks deceptively innocent. This will help mask the taste, though I must warn you that mercury has a distinctive flavor that many patients find memorable. Tom, you accept the spoon with trembling fingers, partly from the fever and partly from a growing sense that you're about to ingest something that future generations would consider extremely unwise. The mixture is heavier than you expected, and when you bring it close to your face, you can detect a faint metallic odor. All at once now, Dr. Blackwell instructs. The full therapeutic dose must be consumed to achieve the proper effect. The taste is unlike anything you've ever experienced. The mercury itself seems to coat your mouth with a metallic film that makes your teeth feel strange and your gums tingle unpleasantly. The honey helps, but only marginally, and within seconds your entire mouth feels numb and alien. Excellent, Dr. Blackwell observes, watching your reaction with professional interest. The immediate oral response indicates that the mercury is already beginning to interact with the corruption in your system. You try to swallow, but your throat feels worse than before, and now there's an additional burning sensation that wasn't present previously. Your lips begin to feel swollen and tingly, as if you've been stung by numerous small insects. The mercurial treatment works by promoting salivation. Dr. Blackwell explains, beginning to pack away his instruments. You may notice increased saliva production over the next several hours. This is the mercury drawing the putrid humours from your system through the natural elimination of corrupted bodily fluids. Indeed, you're already beginning to produce more saliva than usual, and the taste of mercury seems to be intensifying rather than fading. You try to ask a question, but your tongue feels thick and uncooperative. Speech difficulties are temporary. Dr. Blackwell assures you, misinterpreting your struggles. The mercury causes slight swelling of the oral tissues as it begins its work. Within a day or two, once the corruption has been eliminated, your speech will return to normal. Mrs. Henderson brings you a cup of water, which you accept gratefully. However, drinking proves more challenging than expected. The water tastes metallic, and swallowing requires more effort than it should. The treatment may seem uncomfortable. Dr. Blackwell continues, snapping his bag shut with an air of professional completion. But mercury has been used successfully for centuries. The great physician Paracelsus himself said, "The dose makes the poison," meaning that any substance can be beneficial when used in proper therapeutic quantities. As he prepares to leave, Dr. Blackwell delivers his final instructions with the confidence of a man who has never questioned the wisdom of his profession. Continue the mercury treatment twice daily for 1 week. I shall return in 3 days to assess your progress. If the fever persists, we may need to consider additional bleeding or perhaps the application of leeches to the throat area. You nod weakly, not trusting yourself to speak coherently. Your mouth feels as though it belongs to someone else, and your lips seem to have expanded to twice their normal size. The fever continues unabated, your throat still hurts, and now you have the additional challenges of mercury poisoning to contend with. After Dr. Blackwell's departure, Mrs. Henderson sits beside you with a worried expression. "How are you feeling, dear?" You try to answer, but the words come out slurred and indistinct. The mercury has left you with a lisp that makes every syllable a struggle, and the metallic taste seems to be getting stronger rather than weaker. "Don't try to talk," she advises kindly. "Rest is what you need now. Though I must say, I've never been entirely convinced that mercury is as beneficial as the doctors claim. My own mother used to treat sore throats with warm salt water and honey, and we never had to worry about our tongues swelling up like sausages." As you settle back in the chair, you realize that you've now experienced two of Victorian medicine's most celebrated treatments and feel considerably worse than when you started. Your blood has been drained, your mouth has been poisoned with mercury, and your original symptoms remain entirely unchanged. The thought occurs to you that surviving illness in 1847 might require surviving the cure first. Despite Dr. Blackwell's instructions to rest, the close air of the lodging house has become oppressive. Your fever makes every breath feel thick and inadequate, and the combination of coal smoke cooking odors and the general mustiness of too many people in too small a space creates an atmosphere that seems more likely to worsen your condition than improve it. Mrs. Henderson, noting your restlessness, suggests a walk. "A bit of fresh air might do you good," she says, though her tone suggests she's not entirely convinced by her own words. London air has curative properties, according to some. You gather your coat and step outside, immediately regretting the decision. What passes for fresh air in the East End of London in 1847 is something that would make a modern person reach for a gas mask. The fog isn't just fog, it's a mixture of coal, smoke, industrial emissions, and something that might charitably be called urban particulates. The air has a yellowish tinge that makes everything look as though you're viewing it through a piece of amber. Each breath carries the taste of sulfur and soot, and within minutes your throat feels even more irritated than before. Yet around you, Londoners go about their daily business as though breathing liquid smoke is perfectly normal. An elderly gentleman shuffles past, his coat collar turned up against the acrid air. He notices your obvious discomfort and stops to offer advice. "First time in the London fog, is it?" he asks, his voice carrying the gravelly tone of someone who has been breathing this air for decades. "You'll get used to it. In fact, many doctors recommend London air for chest complaints. The smoke has medicinal properties, you see, kills the bad humours floating about." His logic seems questionable, but he delivers it with the confidence of someone sharing indisputable wisdom. My own physician told me that the coal smoke acts like a constant fumigation of the lungs. Keeps the consumption away, it does. You nod politely, not trusting your mercury-impaired speech to convey anything coherent. The old man takes your silence as encouragement to continue. Of course you have to breathe it properly. Deep breaths, mind you, none of this shallow panting that city newcomers do. Fill your lungs right up with good London air, and you'll feel the beneficial effects immediately. To demonstrate, he takes what he clearly considers a therapeutic deep breath, which immediately triggers a coughing fit that lasts nearly a minute. When he recovers, he wipes his eyes and grins triumphantly. "There you see, that's the corrupted air being expelled from my system. Very beneficial, that is." As you continue your walk, you encounter other examples of folk wisdom that seem to defy logic. A woman selling flowers from a cart near the corner insists that the scent of fresh blooms will counteract the putrid vapors that cause disease. She encourages you to purchase a small bouquet, claiming that holding flowers close to your nose will prevent the illness from spreading to your lungs. The flowers are wilted and smell more of the street than of any garden, but her certainty is so absolute that you find yourself considering the purchase. In a world where medical knowledge is still evolving, the line between folk remedy and scientific treatment is often invisible. A chimney sweep, his face blackened with soot, overhears the flower seller's pitch and laughs. Flowers waste of money, that is. What you need is a good dose of chimney smoke. I breathe it all day, every day, and I haven't been sick in years. He gestures to his soot-covered clothes as evidence of his robust health, though you notice he punctuates his speech with frequent coughing. The secret is to get the smoke while it's still hot from the fire. Cold smoke doesn't have the same beneficial properties. As if to prove his point, he positions himself directly in the path of smoke, billowing from a nearby chimney, and takes several deep breaths. The result is another coughing fit, but he emerges from it with evident satisfaction. "Feel that burning in your chest?" he asks, his eyes watering. "That's the smoke doing its work, killing off any corruption that might be trying to take hold." You continue your walk, collecting an increasingly bewildering array of contradictory advice. A baker insists that breathing the yeast-scented air from his shop will cure respiratory ailments. A blacksmith claims that standing near his forge and inhaling the metal-scented heat will strengthen your constitution. A woman hanging laundry suggests that the smell of soap and hot water has protective properties against disease. Each person speaks with absolute conviction, and each remedy seems to involve deliberately exposing yourself to substances that logic suggests might be harmful. Yet these people have survived in this environment, and their confidence in their methods is unshakable. By the time you return to the lodging house, your throat feels significantly worse. Your head is spinning from the combination of fever and toxic air, and your mouth still tastes of mercury. The fresh air cure has proven as ineffective as the bloodletting and mercurial treatment. Mrs. Henderson takes one look at you and shakes her head. "London air," she mutters disapprovingly. "More likely to kill you than cure you if you ask me, but don't tell the doctors I said that they're convinced that city air has medicinal properties." As you collapse back into your chair, you reflect on the strange world you've entered. In 1847, the very air is considered medicine. Toxic substances are consumed as cures, and the loss of blood is thought to promote health. It's a world where the distinction between helpful and harmful is often determined more by tradition and authority than by actual results. Your fever continues, your throat remains sore, and now you have additional symptoms from the attempted cures. Yet somehow the sheer absurdity of the situation is oddly comforting. There's something deeply human about these earnest attempts to help, even when the help proves counterproductive. Inside St. Bartholomew's Hospital, the atmosphere hits you immediately, a complex mixture of carbolic acid, unwashed bodies, medicinal preparations, and something indefinably institutional that speaks of countless human dramas played out within these walls. The air itself seems thick with the accumulated suffering and hope of generations of patients who have passed through these corridors seeking relief from ailments both common and exotic. The entrance hall is a study in Victorian institutional architecture, high ceilings that seem designed to make individual humans feel appropriately small and humble, tall windows that filter the London light into something appropriately solemn, and stone floors that echo with every footstep, creating a natural acoustic environment where privacy is impossible and every sound becomes part of the collective medical drama. The corridors stretch away in multiple directions, each leading to different departments that specialize in various aspects of human suffering. Signs painted in severe black letters on white boards direct traffic toward surgical ward, fever cases, women's medical and consumption treatment, clinical categories, that reduce the full spectrum of human illness to manageable administrative divisions. The sounds that fill these corridors would be impossible in any modern medical facility. Groans of pain echo from various directions, occasionally punctuated by screams that suggest surgical procedures are being conducted without adequate anesthesia, which in 1847 they often are. The sound of violent retching comes from one ward while another produces the distinctive rattling cough that characterizes advanced consumption. A nurse approaches with the swift, efficient stride of someone who has learned to triage thousands of patients and has developed the kind of professional callousness that allows her to function effectively in an environment of constant crisis. She's a woman in her 40s wearing a white apron that has seen better days but is clearly kept as clean as circumstances permit. Her face bears the particular expression of controlled compassion that medical professionals develop when they must balance empathy with the practical necessity of making rapid decisions about treatment priorities. "Fever and throat complaint?" she asks briskly, making notes on a piece of paper attached to a wooden clipboard with practiced efficiency. Her tone suggests that this is neither the first nor the most dramatic case she's encountered today, and that she's already mentally cataloguing your condition against her extensive experience with similar presentations. Mrs. Henderson nods and provides a succinct summary of your medical history. Dr. Blackwell treated him yesterday, bloodletting and mercury for putrid throat. The fevers persisted and he's been getting progressively worse, despite the treatments. The nurse makes additional notes with obvious approval of Dr. Blackwell's approach. Good, proper medical intervention from the start. We'll assign him to Ward 7, that's where we concentrate our putrid fever cases for specialized treatment and to prevent the spread of corrupted humors to other patients. She leads you down a corridor that serves as a kind of medical thoroughfare lined with patients on stretchers in various stages of consciousness and distress. Some are clearly delirious with fever, muttering incomprehensibly to invisible companions or carrying on animated conversations with people who exist only in their heat-addled minds. Others lie unnaturally still, their breathing shallow and labored, suggesting conditions that may be beyond the hospital's ability to address effectively. The walls of the corridor are painted in the kind of institutional green that's supposed to be calming, but instead creates an atmosphere of perpetual twilight. Gas lamps provide illumination at regular intervals, their flickering flames creating constantly shifting shadows that give the entire scene an almost theatrical quality, which in many ways it is. Ward 7 proves to be a long, narrow room with tall windows that would provide excellent natural light if they weren't so thoroughly coated with London's omnipresent soot. 2 rows of beds line the walls, each occupied by someone suffering from various stages of fever-related illness. The beds themselves are simple iron frames with straw mattresses, their occupants covered with rough wool blankets that appear to be institutional issue. Your assigned bed is positioned between 2 other patients whose conditions provide an immediate education in the possible trajectory of your own illness. To your left lies a young woman of perhaps 20, her face flushed with fever and her breathing rapid and shallow. She occasionally speaks coherently, asking for water or mentioning family members, but more often she mutters incomprehensibly, her words lost in the kind of delirium that high fever creates. To your right, an older man lies propped up on several pillows, his breathing labored and accompanied by a rattling sound that suggests his condition has progressed to involve his lungs. His skin has taken on the greyish pallor that experienced medical personnel recognize as a concerning sign, and his eyes have the unfocused quality that comes with advanced illness. The nurse assists you in settling onto your assigned bed, which consists of a narrow cot with sheets that are clean but rough against your fevered skin. As you adjust to your new surroundings, you become aware of the complex soundscape that characterizes a Victorian fever ward. the collective breathing of 30 patients in various stages of respiratory distress, periodic coughing that ranges from dry and hacking to wet and productive, and the occasional cry or moan that punctuates the otherwise steady background of institutional medical care. The doctor will see you shortly, the nurse informs you, though her tone suggests that shortly is a relative term in hospital time where medical priorities are determined by crisis rather than convenience. In the meantime, try to rest and avoid exciting yourself. Agitation can worsen fever conditions and interfere with treatment effectiveness. She hands you a wooden stick approximately the size of a pencil, worn smooth by countless previous patients. Keep this with you and bite down on it if the treatments become uncomfortable. It prevents tongue damage and gives you something to focus on during difficult procedures. The casual way she mentions treatments becoming uncomfortable, combined with the matter-of-fact presentation of a device specifically designed to prevent you from biting through your own tongue, provides a sobering preview of what hospital medicine in 1847 might involve. The wooden stick, polished by the teeth marks of previous patients, serves as a tangible reminder that pain management in this era is primitive at best. As you wait for medical attention, you have ample opportunity to observe the daily routine of a Victorian fever ward. Nurses move efficiently between patients, dispensing medications, adjusting pillows, and providing the kind of basic comfort care that represents the most effective treatment available for many conditions. Their movements have the practiced quality that comes from performing the same tasks repeatedly under challenging circumstances. Occasionally, more dramatic events interrupt the ward's routine. A patient's condition deteriorates, suddenly requiring urgent attention from medical staff who respond with the kind of controlled urgency that suggests this is neither unexpected nor unusual. Screens are positioned around beds when privacy is needed for treatments, or examinations creating temporary islands of medical drama within the larger institutional environment. The young woman in the bed next to yours drifts in and out of coherent conversation. During her lucid moments, she explains that she's been in the hospital for 5 days with what the doctors call putrid fever. The treatments she describes repeated bloodletting, mercury applications, and something called blistering that she doesn't explain in detail sound both extensive and harsh. The worst part, she confides during one of her clearer periods, isn't the illness itself, it's wondering whether the cure might be more dangerous than the disease. But what choice do we have? The doctors know things that we don't, and if we don't trust them, who else is there to trust? Her question captures something essential about the relationship between patients and medical authority in this era. In a world where effective medicine is still largely theoretical, and most treatments are based on centuries-old theories about bodily humours, faith in medical expertise often requires ignoring evidence that the treatments themselves might be causing harm. The older man on your other side is less conversational, but during his more alert moments he shares fragments of his medical experience that provide glimpses into the reality of Victorian hospital treatment. He's been here for 2 weeks with what the doctors call fever of the chest, and his treatments have included not only the standard bloodletting and mercury, but also the application of leeches to draw blood from specific areas and something called cupping that he describes as involving heated glass vessels applied to his back. The theory he explains with the weary patience of someone who has had considerable time to think about his situation is that illness represents an imbalance in the body's natural systems and that treatment must restore the proper equilibrium through various forms of intervention. Whether it's working, he trails off with a shrug that suggests he's no longer entirely convinced by the medical explanations he's received. As afternoon approaches and the ward settles into its daily rhythm of treatment and routine care, you realize that you're about to experience firsthand what represents the most advanced medical care available in 1847. The hospital's approach to fever treatment will demonstrate both the sophistication of Victorian medical theory and its fundamental limitations, a combination that could prove either therapeutic or disastrous, depending on factors that remain entirely beyond your control or understanding. The wooden stick in your hand serves as a constant reminder that whatever happens next will likely be memorable, if not necessarily pleasant. In the world of 1847, medicine survival often depends as much on enduring the cure as on overcoming the original illness. Dr. Hemsworth, when he finally arrives at your bedside later in the afternoon, proves to be a man in his early 30s with the kind of intense enthusiasm that suggests he's relatively new to the practice of medicine and still firmly convinced that aggressive intervention is not only preferable to conservative care, but represents the very pinnacle of scientific advancement. His eyes carry the bright fervor of someone who has recently completed his medical education and believes implicitly in every theory he's been taught. Unlike Dr. Blackwell's measured confidence, Dr. Hemsworth's approach suggests a man eager to prove himself through the application of the most modern medical techniques available. He carries himself with the slight swagger that comes from having access to cutting-edge knowledge, and his manner suggests that he views your case as an opportunity to demonstrate the superiority of hospital medicine over the crude interventions available outside institutional walls. "Ah, yes," he says with evident satisfaction, examining the detailed notes that the nursing staff has prepared during your hours of observation. Classic presentation of putrid fever with significant throat involvement. I see that Dr. Blackwell provided preliminary treatment, bloodletting, and mercury application. Excellent foundation for more advanced intervention. He spreads your medical chart across the small table beside your bed, studying it with the intensity of a general planning a military campaign. The chart itself is a fascinating document, a handwritten record that tracks not only your symptoms and treatments, but also observations about your general constitution, your response to previous therapies, and detailed notes about the progression of your condition since admission. Previous bleeding removed 8 3/4 ounces. He reads aloud apparently for the benefit of the nursing student who accompanies him on his rounds. Mercury treatment administered with standard honey preparation. Patient shows typical mercury response, oral swelling, excessive salivation, speech impediment, all positive indicators that the treatment is engaging effectively with the corrupted humors. The nursing student. A young woman whose spotless uniform and nervous attention suggests she's relatively new to hospital work, takes careful notes as Dr. Hemsworth delivers what is clearly intended as an educational presentation. Your illness has become a teaching case, an opportunity for medical instruction that transforms your suffering into an academic exercise. Now, Dr. Hemsworth continues opening his medical bag with the flourish of someone about to reveal wonderful treasures. We shall proceed with what I consider the most scientifically advanced approach to putrid fever currently available to medical science. Rather than relying solely on systemic interventions like bloodletting and mercury, we shall employ direct, localized treatment at the specific site of corruption. He produces what appears to be a small knife, but one that's been crafted with considerably more precision than Dr. Blackwell's lancet. The blade gleams with the kind of surgical sharpness that suggests it's been designed specifically for delicate medical work, and its handle bears the kind of fine engraving that indicates both quality and expense. Local bloodletting directly at the site of inflammation. He explains with obvious excitement, holding the instrument up for examination by both you and his student. Rather than waiting for mercury to draw out the corruption through the general circulation, a process that can take days and may not reach the source of the problem, we address the issue directly. through precise surgical intervention. The nursing student looks appropriately impressed by this explanation, though you notice she also looks slightly pale at the prospect of what such precise surgical intervention might involve. Her expression suggests that while she's committed to learning advanced medical techniques, she hasn't yet developed the professional callousness that allows experienced medical personnel to discuss cutting into human flesh with casual enthusiasm. The theoretical foundation Dr. Hemsworth continues clearly enjoying his role as medical educator represents a fusion of traditional humoral medicine with modern surgical precision. Think of it as the marriage of ancient wisdom with contemporary scientific methodology. He begins arranging his instruments on the small table beside your bed with the methodical precision of someone who has practiced this procedure many times, though perhaps not always with optimal results. Each tool is placed in a specific position that suggests both ritual significance and practical necessity. Sharp blades for incision, small cups for collecting blood, various solutions for cleaning and treating wounds, and what appears to be a selection of needles for purposes you'd rather not contemplate. The blade that he selects for the initial procedure catches the afternoon light filtering through the ward's grimy windows, creating small flashes of brilliance that seem almost hypnotic in their intensity. The metal has been polished to a mirror finish, and its edge appears sharp enough to cut through paper or human flesh with minimal resistance. This may cause some temporary discomfort, Dr. Hemsworth admits, though his tone suggests he considers such discomfort a reasonable price to pay for the advancement of medical science. However, the relief should be almost immediate once we've successfully released the pressure from the accumulated corrupted humours in the throat area. The nursing student assists him in preparing the area around your throat, applying some kind of solution that stings slightly and smells strongly of carbolic acid. The liquid is cold against your fevered skin, and its sharp chemical odour seems to cut through the persistent metallic taste that has dominated your mouth since Dr. Blackwell's mercury treatment. The key to successful local intervention, Dr. Hemsworth explains while making his final preparations, lies in precise placement of the incisions. Too shallow and we fail to reach the corrupted humours. Too deep and we risk unnecessary damage to healthy tissue. The skill lies in finding that perfect balance point where therapeutic intervention achieves maximum benefit with minimal trauma. Your eyes widen with alarm as the full implications of his casual discussion become clear. This isn't simply another application of mercury or additional bloodletting from your arm, Doctor. Hemsworth intends to make cuts directly in your throat area, working on the assumption that your illness is caused by corrupted humours that have accumulated precisely where your symptoms are most evident. Dr. Hemsworth misinterprets your expression of growing horror as intellectual curiosity about his innovative medical techniques. The theoretical foundation is quite elegant. He continues warming to his subject with the enthusiasm of someone sharing a fascinating discovery. Traditional medicine recognizes that illness often manifests at specific bodily locations where corrupted humours congregate. Modern surgical technique allows us to address these concentrations directly, rather than hoping that systemic treatments will eventually reach the source of the problem. The nurse assists him in positioning you for optimal access to your throat area, adjusting pillows and arranging your head and shoulders in a way that exposes your neck completely while restricting your ability to move during the procedure. The positioning is clearly the result of considerable experience with patients who might be less than enthusiastic about having sharp instruments applied to sensitive areas of their anatomy. The blade will create small, precise incisions. Dr. Hemsworth explains, apparently believing that detailed description will somehow make the procedure more acceptable. Each cut will be positioned to access specific accumulations of corrupted humours while avoiding major blood vessels and other vital structures. The goal is therapeutic drainage rather than surgical damage. As he brings the gleaming blade closer to your throat, you realize that you're about to experience firsthand one of Victorian medicine's most direct and potentially dangerous approaches to treating illness. The wooden stick that the nurse provided earlier suddenly seems woefully inadequate for what's about to happen, and you begin to understand why some patients might prefer the relative safety of delirium to the harsh realities of cutting-edge medical treatment. The nursing student watches the proceedings with fascination mixed with obvious apprehension, taking notes on Dr. Hemsworth's technique while trying not to look too closely at the actual application of blade to flesh. Her educational experience is expanding rapidly, though whether this represents beneficial learning or traumatic exposure to medical practices that future generations might consider barbaric is unclear. Deep breath now, Doctor. Hemsworth instructs, his voice taking on the calm, authoritative tone that medical professionals use when they're about to cause pain in the service of healing. The anticipation is often more distressing than the actual procedure. Once we begin, the therapeutic process moves quite quickly. As the blade makes contact with your skin, you discover that Dr. Hemsworth's assessment of the relationship between anticipation and reality is unfortunately completely wrong. The sharp sting of the initial incision is followed immediately by a burning sensation that spreads across your throat like liquid fire, and the sight of your own blood beginning to flow from deliberately inflicted wounds creates a kind of psychological shock that no amount of medical explanation can adequately prepare you for. "Excellent," Dr. Hemsworth murmurs, with professional satisfaction observing the immediate results of his intervention. Look at that blood flow, quite dark and thick, indicating significant corruption at the local level. This confirms that direct intervention was absolutely the correct therapeutic approach. The nursing student dutifully records his observations, though her handwriting has become noticeably shakier as the procedure progresses. Her educational experience is proving more vivid than anything her textbooks might have prepared her for, and her expression suggests she's beginning to understand why hospital medicine requires not only technical knowledge but also considerable emotional resilience. The drainage we're achieving. Dr. Hemsworth continues, apparently oblivious to your discomfort, as he focuses on the medical significance of what he's accomplishing, represents the direct removal of corrupted humours that have been accumulating at the site of greatest inflammation. This targeted approach should provide relief much more rapidly than systemic treatments alone. Why, as the procedure continues, with Dr. Hemsworth making additional small incisions to ensure what he calls complete drainage of localized corruption, you realize that hospital medicine in 1847 represents both the most advanced therapeutic knowledge available and a level of direct physical intervention that makes previous treatments seem almost gentle by comparison. The wooden stick in your mouth proves essential, not only for preventing tongue damage, but also for giving you something to focus on other than the increasingly surreal experience of having an enthusiastic young doctor methodically cut holes in your throat while explaining the theoretical foundations of his technique to an increasingly pale nursing student. As Dr. Hemsworth completes his procedure and begins the process of bandaging your throat with strips of clean linen, the relative quiet of the fever ward is suddenly shattered by a series of sounds that seem to come from somewhere else in the hospital. Complex screams that carry a different quality than the typical expressions of physical pain that punctuate daily life in Ward 7. These sounds have a wild, desperate quality that speaks not of bodily suffering, but of mental anguish, and they're accompanied by what appears to be violent struggling and the authoritative voices of multiple people attempting to restore order to a situation that has clearly gotten out of control. The nursing student looks up from her notes with obvious alarm, But Dr. Hemsworth continues his bandaging work with practiced indifference, apparently accustomed to such disturbances. The asylum ward, he explains matter-of-factly, noting the student's expression. It's located in the East Wing, just adjacent to the medical wards. Sometimes the patients there become excitable. His casual dismissal of what sounds like considerable human suffering reflects the medical profession's approach to mental illness. In 1847, a combination of theoretical understanding based on humoral medicine and practical management techniques that often amount to physical restraint and chemical sedation. The fact that the asylum is located within the same building as the general medical ward speaks to the era's view of mental illness as simply another category of bodily disorder requiring institutional treatment. As the sounds from the asylum ward continue, screams punctuated by the crash of furniture being overturned, and the authoritative shouts of staff members working to restore control, you become aware that St. Bartholomew's Hospital represents not just a centre for treating physical ailments, but a comprehensive institution for managing all forms of human suffering that Victorian society considers medical in nature. The patient in the bed next to yours, who has been drifting in and out of coherent conversation throughout the day, suddenly becomes more alert as the sounds from the asylum penetrate the fever ward. That's where they take the ones who don't get better, he explains, with the matter-of-fact tone of someone sharing common knowledge. Not just the ones who were mad when they came in, but the ones who go mad from the treatments. His comment sends a chill through you that has nothing to do with fever or blood loss. The casual way he discusses the possibility that medical treatment might drive patients insane suggests that this is a recognized, if rarely discussed, outcome of hospital care in this era. Dr. Hemsworth, overhearing this exchange, feels compelled to provide professional clarification. The asylum ward serves an important medical function. He explains while making final adjustments to your bandages. Some patients arrive with pre-existing mental deterioration, while others develop what we call hospital fever, a condition where prolonged illness affects the brain's functioning. He pauses in his work to address what he clearly considers a teaching moment. The treatments we provide are sometimes vigorous, and patients with weak constitutions may find the therapeutic process overwhelming to their mental faculties. The asylum ward provides specialized care for those who require additional support during their recovery period. The euphemistic way he describes what appears to be treatment-induced mental breakdown reflects the medical profession's reluctance to acknowledge that their therapies might sometimes cause more harm than healing. By framing mental deterioration as evidence of patient weakness rather than treatment failure, Victorian medicine maintains its theoretical integrity while acknowledging practical limitations. The sounds from the asylum ward gradually subside, though whether this represents successful restoration of calm or simply the exhaustion of whoever was creating the disturbance is unclear. The nursing student makes additional notes, apparently recording not only the medical procedures she's witnessed, but also the broader institutional context in which those procedures take place. As afternoon transitions toward evening and the ward settles into its routine of ongoing care and periodic crisis, you realize that your throat incisions have added a new dimension to your collection of medical symptoms. The cuts themselves burn with a constant low-level pain that combines unpleasantly with your pre-existing throat irritation, and the bandages make swallowing even more difficult than the mercury had already made it. Dr. Hemsworth expresses satisfaction with his intervention, noting that the drainage of localized corruption has proceeded exactly as medical theory predicts. However, you notice that your fever remains unchanged, your original throat pain persists beneath the new surgical pain, and you now have additional symptoms that didn't exist before you sought medical help. The irony is not lost on you that each attempt to cure your condition has added new problems while leaving the original illness essentially untouched. Your simple sore throat has been transformed into a complex medical crisis involving blood loss, mercury poisoning, and now surgical wounds, all in the name of scientific medical treatment based on theories that may have no relationship to actual healing. The wooden stick in your hand, now thoroughly marked by your teeth, serves as a tangible reminder of how far you've traveled from your original complaint. What began as a minor throat irritation has become a comprehensive educational experience in the realities of Victorian medicine, an education that demonstrates both the sincere efforts of medical professionals and the fundamental limitations of their knowledge. As darkness settles over London and the gas lamps throughout the hospital are lit for the night shift, Ward 7 takes on a different character entirely. The daytime bustle of medical rounds and treatment procedures gives way to a more subdued atmosphere, where the primary sounds become the collective breathing of 30 patients in various stages of illness, punctuated by periodic coughing, groaning, and the occasional delirious outburst from someone whose fever has progressed to affect their mental state. The night staff moves through the ward with the quiet efficiency of people accustomed to working in an environment where rest is crucial but rarely uninterrupted. Their footsteps are softer, their voices lower, and their movements more careful, not out of any particular consideration for patient comfort, but because experience has taught them that disturbing the fragile sleep of seriously ill people often leads to complications that make everyone's job more difficult. Your throat wounds throb with a steady persistence that makes finding any comfortable position nearly impossible. The bandages that Dr. Hemsworth applied with such professional satisfaction have tightened as they dried, creating a sensation of constriction that combines unpleasantly with the burning pain from the incisions themselves. Every attempt to swallow and the mercury treatment has left you producing far more saliva than normal sends fresh waves of pain through the surgical sites. The fever that originally brought you to medical attention continues unabated, creating the peculiar floating sensation that makes everything feel slightly disconnected from reality. The hospital ward around you takes on an almost dreamlike quality in the flickering gaslight, with shadows that seem to move independently and sounds that appear to come from much greater distances than their actual sources. The patient in the bed to your left, the young woman whose fever-induced delirium has been a constant presence throughout your hospital stay, begins experiencing what the night nurse describes as crisis symptoms. Her breathing becomes more labored, her fever spikes to levels that make her skin burning hot to the touch, and her delirious conversations with invisible companions become more agitated and desperate. "Please," she pleads with someone, only she can see her voice carrying the particular urgency that comes with fever-induced hallucinations.
"I've done everything the doctors asked. I've taken the mercury, I've submitted to the bleeding, I've endured the treatments. Why won't the pain stop? Why won't you help me?" Her words create an eerie echo of your own experience, and listening to her desperate appeals to imaginary figures makes you wonder if your own mental state might be less stable than you've been assuming. The line between rational thought and fever-induced delirium seems increasingly thin when you're surrounded by people whose illnesses have progressed to affect their perception of reality. The night nurse, a woman whose age and experience show in every movement, approaches the young woman's bed with the kind of calm competence that suggests she's dealt with similar situations countless times.
She checks the patient's pulse, feels her forehead to assess fever levels, and makes notes on a chart while speaking in the low, soothing tones that medical professionals use when they want to provide comfort without making promises they can't keep. The crisis often comes before the cure, she explains quietly, apparently, as much to you as to the delirious patient. When the fever reaches its peak, the body either overcomes the illness or sometimes the struggle becomes too much for the constitution to bear. Her matter-of-fact acknowledgement that some patients simply don't survive their illnesses provides a sobering reminder of the stakes involved in Victorian medical care. In an era before effective treatments for most conditions, hospital stays often represent a gamble where the outcome depends as much on luck and personal constitution as on medical intervention. The man in the bed to your right, whose condition has been gradually deteriorating throughout your stay, begins experiencing what appears to be serious respiratory distress. His breathing becomes increasingly labored, accompanied by a rattling sound that suggests fluid accumulation in his lungs. The night nurse responds to this development with increased attention positioning, additional pillows to help him breathe more easily, and administering what appears to be some kind of liquid medication. Lung fever, she explains briefly, when she notices your attention. Common complication when putrid fever progresses to involve the chest. We'll do what we can to keep him comfortable. The euphemistic way she discusses keeping him comfortable, rather than treating his condition, suggests that medical options for advanced lung involvement are limited and that the primary goal has shifted from cure to palliative care. This progression from active treatment to comfort measures provides another reminder of how quickly Victorian medical situations can deteriorate beyond the reach of available therapeutic interventions. As the night progresses, you witness the full spectrum of hospital medical care in action. Some patients show signs of improvement, fevers breaking, breathing, becoming easier, delirium, giving way to coherent conversation. Others clearly deteriorate, requiring increasingly intensive nursing attention and what appear to be end-of-life preparations that the staff performs with practiced discretion. The young woman's fever finally peaks sometime around midnight, creating a medical crisis that draws multiple staff members to her bedside. They work quietly but urgently, applying cold cloths to reduce her temperature, administering medications that may or may not prove effective, and providing the kind of intensive nursing care that represents the most advanced life support technology available in 1847. Whether through the effectiveness of their interventions or simply the natural course of her illness, her fever eventually breaks, leaving her weak but coherent for the first time since your arrival. Her recovery provides a dramatic example of how quickly Victorian medical situations can change, and serves as a reminder that sometimes patients do survive despite the limitations of available treatments. Your own condition seems to have stabilized at a level that's uncomfortable but not immediately life-threatening. The throat incisions continue to burn, the mercury effects persist in making your mouth feel foreign and swollen, and the blood loss has left you feeling weak and light-headed. However, your fever appears to have plateaued rather than continuing to rise, suggesting that your body may be beginning to mount an effective response to whatever infection started this entire medical odyssey. As dawn approaches and the night shift prepares to hand over responsibility to the day staff, you realize that you've survived your first night in a Victorian hospital, an accomplishment that should not be taken lightly in an era when institutional medical care often proves as dangerous as the illnesses it's designed to treat. The dawn light filtering through Ward 7's grimy windows brings with it a renewed bustle of medical activity as the day shift arrives to assess the overnight developments and plan the continuation of various treatment protocols. The morning medical rounds in a Victorian hospital represent a complex ritual that combines genuine patient care with professional education, institutional hierarchy, and the kind of medical theatre that turns human suffering into learning opportunities for the next generation of physicians. Dr. Hemsworth arrives accompanied not only by his usual nursing student, but also by what appears to be a senior physician whose presence immediately changes the atmosphere of the ward. Dr. Worthington is clearly a man of considerable medical authority, His bearing suggests decades of experience. His clothing indicates substantial prosperity, and his manner carries the kind of unquestioned confidence that comes from occupying the top of the medical profession's social hierarchy. Ah, Dr. Hemsworth, he says, examining your chart with the casual attention of someone reviewing routine paperwork. I understand you've been experimenting with local intervention techniques for putrid fever cases. Interesting approach. Let's examine the results of your innovation. The characterization of your throat incisions as experimental comes as something of a surprise, suggesting that Dr. Hemsworth's enthusiasm for cutting-edge medical techniques may have exceeded the boundaries of established therapeutic practice. You're apparently serving not only as a patient, but as a test case for new medical procedures, a role that no one bothered to explain when the treatments were being administered. Dr. Worthington's examination is thorough and entirely impersonal, treating your body as an object of scientific interest rather than a person experiencing pain and distress. He probes the bandaged incisions with clinical curiosity, observes your mercury-induced oral symptoms with professional interest, and reviews the documentation of your blood loss with the detached analysis of someone studying abstract data rather than human suffering. The local drainage approach shows promise, he concludes after completing his assessment, though the therapeutic benefit remains unclear at this stage. The patient's fever persists despite multiple interventions, and the original throat symptoms appear unchanged. His frank acknowledgement that the various treatments have failed to produce any measurable improvement in your condition is delivered with the kind of scientific objectivity that ignores the fact that you've become progressively sicker since seeking medical help. From his perspective, your lack of improvement represents interesting data rather than treatment failure. Perhaps, Dr. Worthington suggests with the tone of someone proposing an academic exercise, we might consider the application of leeches to complement the bloodletting and local intervention. The combination of systemic and localized blood removal could provide enhanced therapeutic benefit. The casual way he discusses attaching blood-sucking creatures to your already traumatized throat area suggests that Victorian medicine's capacity for innovation in the direction of increasingly invasive treatments is virtually unlimited. Each failure to achieve improvement seems to inspire additional interventions rather than reconsideration of the underlying theoretical approach. Dr. Hemsworth receives this suggestion with obvious enthusiasm, apparently viewing it as validation of his experimental approach and an opportunity to expand his experience with cutting-edge therapeutic techniques. Excellent suggestion, Dr. Worthington. The theoretical foundation is quite sound. If local corruption requires direct intervention, then enhanced local bloodletting should provide proportionally greater benefit. Borgeek, the nursing student, dutifully records this exchange, her notes, documenting not only the medical decision-making process, but also the hierarchical dynamics that determine how treatment decisions are made in institutional settings. Your preferences, concerns, or comfort level play no apparent role in discussions about what additional procedures might be inflicted upon your person. The leech treatment, when it's implemented later that morning, proves to be every bit as disturbing as you'd anticipated. The creatures themselves are larger than you'd expected, dark, segmented things that move with an unsettling purposefulness when they're applied to the bandaged areas around your throat incisions. Their attachment creates a peculiar sucking sensation that combines with the existing pain from the cuts to produce a complex symphony of discomfort that no previous experience had prepared you for. The leeches are quite selective in their action. Dr. Hemsworth explains with educational enthusiasm while monitoring their progress. They naturally seek out areas where corrupted blood has accumulated, providing targeted therapy that bloodletting from distant sites cannot achieve. The theoretical elegance of this explanation is somewhat undermined by the fact that the leeches appear to be indiscriminately consuming any blood they can access regardless of its supposed level of corruption. Their feeding creates additional bleeding that supplements the drainage from your surgical incisions, resulting in a level of blood loss that begins to make you seriously concerned about your ability to maintain consciousness. Dr. Worthington observes the leech application with professional satisfaction, apparently viewing it as confirmation of advanced medical practice in action. The combination of surgical drainage and natural bloodletting represents the best of both traditional and modern therapeutic approaches, he notes approvingly. This patient is receiving the most sophisticated treatment available to medical science. The irony that this sophisticated treatment has transformed your minor throat irritation into a life-threatening medical crisis involving multiple forms of blood loss, mercury poisoning, and surgical trauma is apparently lost on the medical professionals who view your case as an example of successful intervention rather than progressive therapeutic disaster. As the morning progresses and the leeches complete their work, you realize that your condition has deteriorated to a point where survival itself has become questionable. The cumulative effects of bloodletting, mercury treatment, surgical incisions, and leech application have left you weak, disoriented, and suffering from a complex array of symptoms that bear little relationship to your original illness. Yet the medical staff continues to view your case with professional optimism, interpreting each new symptom as evidence that their treatments are working rather than recognition that their interventions might be causing more harm than healing. The theoretical framework of Victorian medicine apparently makes it difficult to acknowledge that sophisticated treatments might sometimes be inferior to simple rest and supportive care. The wooden stick in your hand has become so thoroughly marked by your teeth that it's beginning to splinter, serving as a physical reminder of how far your medical journey has traveled from its simple beginning. What started as a sore throat has become an educational experience in the dangers of seeking help in an era when medical confidence far exceeds medical knowledge. By the third day of your hospital stay, your case has apparently attracted sufficient medical interest to warrant what Dr. Worthington describes as a comprehensive therapeutic consultation, an elaborate process that involves assembling multiple physicians to discuss your condition and propose additional treatment strategies. This consultation represents the pinnacle of Victorian medical practice, bringing together the combined expertise of the hospital's most experienced practitioners to address a case that has proven resistant to standard therapeutic approaches. The consultation takes place at your bedside, with your body serving as the focal point for an academic discussion that treats your suffering as an intellectual puzzle rather than a human experience. The assembled physicians, 5 men of varying ages and apparent seniority, examine you with the detached interest of scientists studying a particularly fascinating specimen, discussing your symptoms and treatment responses as if you were not present to hear their deliberations. Dr. Worthington serves as the senior consultant, his authority evident in the way the other physicians defer to his opinions and seek his approval for their suggestions. Dr. Hemsworth presents your case history with the enthusiasm of someone showcasing his experimental techniques to respected colleagues, clearly hoping that your experience will serve as validation of his innovative therapeutic approaches. The patient presented with classic putrid throat fever. Dr. Hemsworth begins consulting his detailed notes. Standard bloodletting and mercury treatment were initiated immediately, followed by hospital admission for more intensive intervention. Local surgical drainage was implemented to address concentrated corruption at the site of greatest inflammation, supplemented by targeted leech application for enhanced blood removal. The way he describes your medical journey makes it sound like a carefully planned scientific expedition, rather than a series of increasingly desperate attempts to address symptoms that have consistently failed to respond to treatment. Each intervention is presented as logical and necessary, with no acknowledgement that the cumulative effect has been to make you significantly sicker than when you started. Dr. Pemberton, an elderly physician whose white hair and dignified bearing suggest decades of medical experience, raises what he considers a crucial theoretical point. The persistence of symptoms despite comprehensive humoral intervention suggests that we may be dealing with a particularly virulent form of corruption, one that requires more aggressive systemic treatment to achieve therapeutic breakthrough. His suggestion is received with obvious interest by the assembled physicians, who begin discussing various approaches to intensifying your medical treatment. The possibility that your lack of improvement might indicate that their treatments are ineffective or harmful seems not to occur to any of them. Instead, treatment failure is interpreted as evidence that even more vigorous intervention is required. Dr. Morrison, a middle-aged practitioner whose reputation apparently rests on his expertise with respiratory ailments, proposes what he calls atmospheric therapy to complement the existing blood and mercury treatments. The patient's throat symptoms suggest involvement of the respiratory passages, he explains. Direct application of medicinal vapors could provide therapeutic benefit that systemic treatments cannot achieve. The atmospheric therapy, when it's implemented that afternoon, involves positioning your head over a basin of steaming water that has been infused with various medicinal substances whose identity and purpose remain mysterious. The vapors that you're required to inhale have an acrid chemical quality that makes your eyes water and your throat burn even more intensely than before, while providing no discernible relief from your original symptoms. Dr. Blackston, whose specialty appears to be the application of heat therapy, suggests that your condition might benefit from what he calls thermal intervention, the application of heated instruments to specific areas of your body to encourage the movement of corrupted humors toward natural elimination pathways. This treatment involves the use of metal instruments that have been heated in the hospital's furnace and then applied to various points on your chest and back, creating painful burns that are supposed to redirect the flow of internal corruption. The experience is indescribable in its intensity, leaving you with a collection of circular burn marks that join your growing catalogue of treatment-induced injuries. Dr. Harrison, the youngest member of the consultation group, proposes what he considers the most scientifically advanced approach available, the administration of what he calls electrical therapy, using a device that generates static electricity through the turning of hand cranks and the manipulation of metal spheres. The electrical shocks that this apparatus delivers are supposed to stimulate the natural vital forces and encourage the body's resistance to corrupted influences. The electrical treatment creates sensations unlike anything you've ever experienced: sharp, jarring jolts that make your muscles contract involuntarily and your teeth ache with phantom pain. The theoretical foundation for this therapy remains unclear, but Dr. Harrison administers it with the confident enthusiasm of someone convinced that he's applying the most cutting-edge medical technology available to human suffering. As each physician contributes his specialized expertise to your treatment protocol, your condition continues to deteriorate rather than improve. The cumulative effects of bloodletting, mercury poisoning, surgical trauma, leech application, chemical vapor, inhalation, thermal burns, and electrical shock have created a medical crisis that bears no resemblance to your original sore throat. Yet, the assembled medical experts continue to view your case with professional optimism, interpreting each new complication as evidence that their treatments are engaging with deep-seated corruption that requires even more intensive intervention to overcome. The possibility that they might be creating more problems than they're solving appears to be outside the conceptual framework that guides their medical thinking. Dr. Worthington concludes the consultation by expressing satisfaction with the comprehensive therapeutic approach that has been assembled. This patient is receiving the most advanced medical treatment available to modern science, he announces with evident pride. The combination of traditional humoral medicine with innovative surgical techniques and cutting-edge technological interventions represents the pinnacle of therapeutic sophistication, with the irony that this sophisticated treatment has brought you to the edge of death, while leaving your original illness essentially untouched, is apparently lost on the medical professionals who view your case as a triumph of scientific intervention rather than a catastrophic failure of medical judgment. As the consultation concludes and the physicians depart to apply their expertise to other patients, you're left alone with your wounds, your poisoning, your burns, and your growing certainty that survival will depend more on your body's natural resilience than on any medical treatment you've received. The wooden stick in your hand has become completely splintered from the pressure of your teeth during the various procedures, serving as a physical metaphor for what the medical profession has done to your originally simple illness. What began as a minor throat irritation has been transformed into a complex, life-threatening medical emergency through the application of every therapeutic technique that Victorian medicine has to offer. The next few days pass in a haze of fever dreams, ineffective treatments, and the gradual realization that your body is waging not one, but two separate battles. One against whatever minor infection originally caused your sore throat, and another against the increasingly dangerous effects of the various cures that have been applied to help you recover. The irony of this situation would be laughable if it weren't potentially fatal. Dr. Hemsworth continues his enthusiastic monitoring of your progress, though progress in this case means the careful documentation of how your body responds to treatments that seem designed more to test the limits of human endurance than to promote healing. His daily examinations have become exercises in creative medical interpretation, where each new symptom is viewed as evidence that the treatments are working, rather than recognition that they might be causing harm. Your throat wounds from his innovative surgical intervention have begun to show signs of infection, a complication that he addresses with additional mercury applications and what he calls purifying solutions that burn like liquid fire when applied to the open cuts. The fact that wounds inflicted in the name of healing are now infected and requiring additional treatment seems to strike him as an interesting medical challenge rather than evidence that his therapeutic approach might be fundamentally flawed. The burns from Dr. Blackstone's thermal therapy have created painful weeping sores across your chest and back that require daily attention from the nursing staff. These new wounds are treated with various salves and ointments, whose composition remains mysterious but whose effectiveness appears minimal. The burns serve as constant reminders that seeking relief from a simple sore throat has led to injuries that would normally be associated with accidents rather than medical treatment. Yet something remarkable begins to happen on the fourth day of your hospital stay, something that occurs not because of the medical interventions you've endured, but in spite of them. Your fever, which has persisted through bloodletting, mercury, treatment surgery, leeches, electrical shock, and thermal burns, finally begins to subside of its own accord. The change is subtle at first, a slight cooling of your skin temperature, a reduction in the floating sensation that has made everything feel disconnected from reality. Your throat, despite the surgical incisions and mercury-induced swelling, begins to feel marginally less inflamed. Most remarkably, you wake one morning without the crushing fatigue that has characterized every day since your illness began. Dr. Hemsworth notices these improvements immediately and attributes them entirely to the success of his comprehensive treatment protocol. Excellent response to therapeutic intervention. He announces with evident satisfaction while examining your chart. The combination of bloodletting, mercury, surgical drainage, and supplementary treatments has clearly overcome the corrupted humours that were causing your systemic distress. The nursing student dutifully records his assessment. though her expression suggests she's beginning to develop her own opinions about the relationship between treatment and recovery. Having observed your condition deteriorate steadily under aggressive medical intervention, and then improve. Only when the treatments were reduced in intensity, she may be drawing conclusions that differ from the official medical interpretation. What has actually happened, you realize, with the peculiar clarity that comes with emerging from fever-induced confusion, is that your body's natural immune system has finally overcome whatever minor bacterial or viral infection caused your original sore throat. The improvement has nothing to do with the bloodletting mercury surgery or electrical therapy. It represents the triumph of natural healing processes over both the original illness and the medical treatments designed to cure it. Your throat, while still sore from the surgical incisions and mercury effects, no longer has the deep inflamed feeling that characterized your original illness. The fever that brought you to medical attention has broken naturally, leaving you weak but clear-headed for the first time in days. Most importantly, you no longer feel like you're dying, a significant improvement that has occurred despite rather than because of professional medical intervention. The contrast between your natural recovery and the medical profession's interpretation of it provides a fascinating glimpse into how Victorian medicine maintains its theoretical integrity in the face of contradictory evidence. Dr. Hemsworth's confidence in his treatments remains absolute, and his willingness to take credit for your improvement is complete, despite the obvious fact that you began getting better only when the intensity of medical intervention was reduced. Mrs. Henderson visits that afternoon and immediately notices the change in your condition. Her experienced eye, honed by years of nursing family members through various illnesses, recognizes genuine improvement when she sees it. "You're looking better, dear," she says with obvious relief. "Though I must say you've given us all quite a scare these past few days." Her comment captures something essential about your medical journey. The original illness that brought you to her attention was minor and would have resolved itself with rest and basic care. The real danger came from the zealous application of medical treatments that were not only ineffective, but actively harmful. Tommy was convinced you were going to die from the cure rather than the illness. She continues with a kind of blunt honesty that cuts through medical euphemisms and professional optimism. He kept saying that people lived for thousands of years without doctors cutting holes in their throats, and maybe there was something to be said for the old ways. Dr. Hemsworth, overhearing this exchange, responds with the kind of professional indignation that medical authority displays when its expertise is questioned by those considered less educated. "Mrs. Henderson, I must protest in the strongest possible terms. This patient presented with a serious putrid fever that required immediate and aggressive intervention. Without proper medical treatment, such conditions frequently progress to systemic involvement and death. His absolute certainty about the necessity of his treatments remains unshaken by the obvious fact that your recovery began only when those treatments were discontinued. The theoretical framework of Victorian medicine apparently makes it impossible to acknowledge that sometimes the best medical intervention is no intervention at all." Of course, Mrs. Henderson replies with the diplomatic tone of someone who has learned to avoid direct confrontation with medical authority while maintaining her own opinions. "I'm sure you know best about these technical matters." But her expression when Dr. Hemsworth isn't looking suggests that she has drawn her own conclusions about the relationship between medical treatment and actual healing. Her grandmother's approach of rest, soup, and patience seems to have proven more effective than the most advanced therapeutic techniques that Victorian medicine has to offer. As afternoon fades toward evening and the ward settles into its routine of ongoing care, you reflect on the strange journey that has brought you from a simple sore throat to the edge of death and back to recovery. The medical profession has provided you with an education in the dangers of seeking help when help might be more dangerous than the problem it's designed to solve. Your body has healed itself, as bodies have been doing for millions of years, but it has had to overcome not only the original infection, but also the effects of bloodletting, mercury poisoning, surgical trauma, thermal burns, and electrical shock. The fact that natural healing processes have proven more effective than professional medical intervention seems to be a lesson that Victorian medicine is incapable of learning. 2 days later, you're deemed well enough for discharge from St. Bartholomew's Hospital, a decision that involves final consultations with the medical team that has overseen your treatment and official documentation of what they consider a successful therapeutic outcome. The discharge process provides an opportunity for the various physicians who have participated in your care to review their interventions and draw conclusions about the effectiveness of their methods. Dr. Worthington conducts the final examination with obvious satisfaction at what he considers a textbook example of how comprehensive medical intervention can overcome serious illness. A most gratifying case, he announces while reviewing your chart one last time. The patient's recovery validates our aggressive therapeutic approach and demonstrates the superiority of institutional medicine over folk remedies and home care. The senior physician's interpretation of your experience transforms your survival of multiple harmful treatments into evidence supporting the very approaches that nearly killed you. His confidence in Victorian medical methods remains absolute, unshaken by any recognition that your improvement began only when the intensity of treatment was reduced. Dr. Hemsworth expresses particular pride in his innovative surgical approach, viewing your survival as validation of his experimental techniques. The local drainage method proved highly effective, he explains to the assembled medical students who have gathered to observe your discharge. This case demonstrates the value of direct intervention over systemic treatment alone. The fact that your throat incisions became infected and required additional treatment, that your original symptoms improved only after natural healing processes overcame both the illness and the medical interventions, and that you nearly died from the cumulative effects of multiple procedures seems to have no impact on his professional assessment of the case. The nursing student who has been documenting your treatment throughout your stay presents you with a detailed summary of the medical care you've received, a document that reads like a catalogue of therapeutic assault rather than healing intervention. The list includes bloodletting, mercury poisoning, surgical incisions, leech application, chemical vapor inhalation, thermal burns and electrical shock, a comprehensive inventory of Victorian medicine's most advanced techniques. You've received the most sophisticated medical treatment available to modern science, she explains, with evident pride in her profession. This experience should provide you with confidence in the effectiveness of proper medical care for any future health concerns. The irony that this sophisticated treatment has left you weaker and more damaged than your original illness would have done on its own appears to be lost on the medical professionals who view your case as a success story rather than a cautionary tale about the dangers of medical overconfidence. As you prepare to leave the hospital, Mrs. Henderson arrives to escort you back to the lodging house, a journey that represents not only a physical transition but also a return from the world of institutional medicine to the realm of common sense and folk wisdom. Her presence serves as a reminder that there are alternative approaches to health and healing that don't involve the systematic application of harmful treatments in the name of scientific progress. The walk back through London's grimy streets provides an opportunity to observe the city with new eyes, shaped by your experience with Victorian medicine. The same coal smoke that Dr. Blackwell recommended as therapeutic air now seems obviously toxic. The street vendors selling miracle cures and patent medicines appear as charlatans rather than alternative healers. The entire urban environment reveals itself as fundamentally hostile to human health, requiring not medical intervention but escape from the conditions that create illness in the first place. Your small room in the lodging house, when you finally reach it, seems like a palace of comfort compared to the hospital ward. The narrow bed with its straw mattress feels luxurious after the institutional cot, and the simple wash basin represents the height of personal convenience. Most importantly, the room is quiet-free from the groans and screams that characterize hospital life, and peaceful in a way that promotes actual rest, rather than medical observation. Mrs. Henderson brings you a cup of tea, simple hot, and blessedly free of mercury or any other medicinal additives. The taste is wonderful, representing the first thing you've consumed in days that was intended purely for comfort rather than therapeutic intervention. The warmth of the tea soothes your still damaged throat in a way that none of the medical treatments manage to achieve. Rest is what you need now, she says, echoing the wisdom that her grandmother apparently understood better than the medical profession. Your body's done the hard work of getting better. Now you just need to give it time to recover from the cure. Her words capture the essential truth about your medical journey, that healing happened not because of professional intervention, but in spite of it. Your body's natural ability to overcome infection proved more powerful than all of Victorian medicine's sophisticated techniques, though it required considerable resilience to survive both the original illness and the treatments designed to cure it. As you settle into your chair by the small window, you can see the hospital's imposing silhouette in the distance, its blackened stones and narrow windows serving as a reminder of the medical ordeal you've survived. The building represents both the pinnacle of Victorian therapeutic sophistication and a cautionary example of how medical confidence can exceed medical knowledge with potentially fatal consequences. Your reflection on the experience reveals the profound gap between medical theory and medical effectiveness that characterizes healthcare in 1847. The doctors who treated you were sincere, educated, and completely convinced of the validity of their methods. Their failure to help you resulted not from malicious intent or professional incompetence, but from the fundamental limitations of medical knowledge in an era before the discovery of germs, the development of effective drugs, or the recognition that sometimes the best treatment is no treatment at all. Tomorrow, you'll wake up in a world where getting sick means navigating a maze of well-intentioned but potentially dangerous medical interventions where seeking help might prove more hazardous than enduring illness, and where survival often depends more on luck and natural resilience than on professional expertise. But tonight you're alive, recovering, and grateful that sometimes the human body's capacity for self-healing proves stronger than even the most determined medical assault. In the growing darkness of your small room, with the distant sounds of London settling into another night around you, like a vast organism seeking its own form of healing, rest you find yourself drifting slowly but inevitably toward the deep, naturally restorative sleep that no Victorian doctor could prescribe, understand, or improve upon, but which your body knows exactly how to provide through ancient wisdom encoded in every cell and fiber of your being. The journey through 1847's medical landscape has taught you profound and lasting lessons about the difference between the appearance of healing and the reality of health, between medical confidence and medical effectiveness, between the impressive sophistication of treatment protocols and the simple wisdom of restraint, patience, and trust in natural processes that have been sustaining life for millions of years. Your throat still bears the faint but persistent scars of Dr. Hemsworth's innovative surgical intervention, though the sharp, burning pain has finally begun to subside as your body's natural healing processes slowly but steadily repair the damage that medical science inflicted in the sincere but misguided name of therapeutic cure. The metallic taste of mercury lingers only occasionally now in your mouth, appearing mostly when you first wake or when you're particularly tired. serving as a fading reminder of Dr. Blackwell's absolute confidence in the therapeutic properties of toxic metals and the dangers of unquestioned medical authority. The circular burns from Dr. Blackstone's thermal therapy have begun their own slow process of healing on your chest and back, the damaged skin gradually replacing itself through the same mysterious biological processes that have been repairing human injuries since the beginning of time. The memory of electrical shock treatment serves as a permanent reminder of how far medical enthusiasm can exceed both medical wisdom and basic human compassion when theory becomes more important than the actual experience of the patient. Yet despite this extensive catalogue of medical wounds, this comprehensive inventory of well-intentioned harm inflicted by educated professionals acting according to the best knowledge available to them, your original sore throat, the simple minor symptom that started this entire medical odyssey, has finally healed completely and naturally. Not through bloodletting that weakened your system or mercury poisoning that created dangerous new symptoms or surgical intervention that added unnecessary trauma, but through the ancient, patient, reliable process of immune response and cellular repair that has been protecting human health for countless millennia, long before the first physician ever picked up a lancet or mixed a mercury preparation with honey. Mrs. Henderson's quiet movements in the next room create a gentle, soothing domestic rhythm that speaks eloquently of care without violence, healing without harm, comfort without complication, and love without conditions. Her approach to health and illness, inherited from generations of wise women who understood intuitively that the human body possesses remarkable powers of self-repair that work best when supported rather than attacked, has proven more effective than all of Victorian medicine's elaborate theories, expensive equipment, and aggressive interventions combined. The profound contrast between her grandmother's wisdom of rest, nourishing soup, and patient waiting, and the medical profession's impressive arsenal of bloodletting, mercury poisoning, and surgical assault provides a gentle but powerful meditation on the true nature of healing itself. Sometimes the most powerful medicine is simply the deliberate absence of harmful treatment, the patience to allow natural processes to work their slow but reliable magic, and the humility to recognize that medical intervention is not automatically superior to medical restraint. Through your window you can see other residents of the lodging house preparing for sleep, ordinary people who will face tomorrow's challenges with the same combination of resilience, community support, and practical wisdom that has helped humanity survive and thrive for countless generations before the invention of hospitals, medical schools, and professional healthcare systems. Their quiet preparations for rest, the soft closing of doors, the gentle murmur of goodnight wishes between family members, the settling sounds of parents gathering their children close for the night, remind you that healing is fundamentally a natural process that occurs best in environments of safety, emotional security, physical comfort, and gentle care. The air in your room, while still carrying the omnipresent scent of London's coal smoke and the general urban atmosphere of a rapidly industrializing city, seems remarkably fresh and clean compared to the carbolic acid, medicinal vapors, and chemical odors that filled the hospital atmosphere during your stay. Even the city's notoriously toxic environment appears relatively benign when compared to the deliberate application of harmful substances in the name of therapeutic intervention and scientific medical progress. As you pull the rough wool blanket up to your chin and settle more deeply into the narrow bed that now feels like the absolute height of luxury and comfort after your hospital experiences with institutional cots and medical supervision, you realize that your week-long medical adventure has provided an education not just in the specific practices of Victorian medicine, but in the fundamental nature of health and illness itself, the relationship between confidence and competence, and the eternal human challenges of knowing when to act and when to wait. You've learned through direct, sometimes painful experience that the human body possesses truly remarkable powers of self-repair that often work best when left undisturbed by helpful interventions, no matter how well-intentioned, scientifically sophisticated, or confidently administered those interventions might appear to be. Your recovery has demonstrated that natural healing processes given adequate time and basic support can overcome not only the original infection, but also the cumulative damage caused by medical treatments designed to help. You've discovered that medical authority and medical effectiveness are not the same thing, and that confidence in treatment methods does not necessarily correlate with their actual benefit, safety, or appropriateness for particular conditions. Most importantly, you've experienced firsthand the profound truth that sometimes the cure can indeed be worse than the disease, and that recognizing this fact requires the courage to question established expertise, the wisdom to trust natural healing processes even when they work more slowly than aggressive interventions, and the humility to admit that sometimes the best thing a healer can do is nothing at all. The sounds of the great city gradually fade as London settles into sleep around you, creating a gentle, ever-changing acoustic backdrop for your own journey toward rest and recovery. The rhythmic clip-clop of horse hooves on cobblestones becomes less frequent, their steady beat growing softer and more distant as the late-night traffic gives way to the deeper quiet of the sleeping hours. The calls of street vendors disappear entirely, replaced by the occasional distant sound of a church bell marking the passage of time or the gentle closing of a door somewhere in the building as other residents settle into their own evening routines. Even the persistent coughing from other rooms in the lodging house begins to quiet, as exhausted bodies and spirits seek the rest that promotes healing better than any medical intervention ever devised by human knowledge or invented by scientific research. The building itself seems to settle and sigh as it adjusts to the cooling night air, its old wooden beams creaking softly in the rhythm of a structure that has sheltered countless generations of Londoners through their own experiences of illness and recovery, hardship and resilience. In the distance, church bells mark the passing hours with their ancient, comforting rhythm, a sound that connects you directly to countless generations of people who have faced illness and recovery with nothing more than time, rest, hope, and the fundamental human capacity for resilience in the face of uncertainty. Their steady tolling creates a peaceful, meditative backdrop for sleep, each chime a gentle reminder that healing is a process measured not in medical procedures, pharmaceutical interventions, or surgical techniques, but in the slow, patient passage of time and the gradual restoration of health through natural means that have been proven effective across all human history. Your breathing deepens and slows naturally as sleep approaches each breath, a small victory over the toxic vapors and chemical treatments that have challenged your respiratory system over the past week. The simple act of breathing clean air, or as clean as London air can be in this sooty industrial era, becomes a form of moving meditation on the basic requirements for health, adequate rest, emotional peace, proper nutrition, clean air, safe shelter, and freedom from harmful interventions disguised as helpful treatments. The darkness outside your window is complete, now broken only by the occasional flicker of gaslight from the street below, or the warm golden glow emanating from windows where other families are settling into their own evening routines of rest, reflection, and preparation for tomorrow's challenges. These small points of light create a beautiful constellation of human comfort and domestic peace that stretches across the entire city, connecting your own experience of healing and rest to the universal human needs for safety, warmth, community, and gentle care. As consciousness begins to fade naturally and sleep gently takes hold of your tired mind and healing body, your last coherent thoughts are filled with gratitude, not for the medical treatments you've endured, but for your body's remarkable ability to heal itself, despite them for the community of caring people who have supported you through this difficult time, and for the simple but profound realization that sometimes the most sophisticated treatment available is simply the patience to step back and let nature take its wise and ancient course. Your gratitude extends to Mrs. Henderson and her practical wisdom earned through years of caring for others, to Tommy's honest observations about the sometimes counterproductive relationship between medical treatment and actual recovery, to all the people in your small community who offered help according to their own understanding and experience, and even to the doctors who, despite their harmful interventions, were genuinely trying to help according to the best knowledge available to them in their time and place and professional training. In your dreams, which are beginning to form gently at the edges of your consciousness, like soft clouds gathering in a peaceful sky, you breathe clean mountain air and drink pure spring water, while somewhere in the distance the sound of gentle laughter echoes through meadows filled with naturally healing herbs and flowering plants that have been used for medicine since the dawn of human knowledge. In this imagined world, medicine heals rather than harms. Doctors understand the limits of their knowledge and work in partnership with natural healing processes, and getting sick is nothing more than a brief interruption in the long, sweet business of being alive and healthy. The last thing you hear before sleep claims you completely is Mrs. Henderson's gentle humming from the next room, a wordless melody that carries more genuine therapeutic power than anything you encountered in all your medical adventures. Her quiet song speaks of generations of women who have comforted the sick, who have trusted in the body's wisdom, who have understood that healing often requires nothing more than time rest, nourishing food, and the presence of someone who cares. This simple human music is more effective than any medicine, more soothing than any treatment, more healing than any procedure ever invented. And in the growing silence of the night, with the great city of London settling into rest around you like a vast organism seeking its own form of healing, sleep, you drift into the deep restorative sleep that represents the most effective medicine of all the kind, that requires no prescription costs. Nothing harms no one and works exactly as nature intended, healing both body and spirit through the simple, ancient act of peaceful rest. Outside your window, the smoke-filled sky gradually clears as the night progresses, and the city's countless fires bank down to glowing coals. Through the thinning haze, stars become visible, the same eternal stars that have watched over countless generations of healers and patients, doctors and sufferers, all learning the same timeless lessons about health and illness treatment, and cure the promises of medicine and the reliable power of natural healing. These celestial lights have witnessed the rise and fall of medical theories, the confidence and errors of countless physicians, the suffering and recovery of millions of patients throughout human history. They have seen the invention of treatments that seemed miraculous in their time but proved harmful in retrospect, and they have observed the gradual, often painful progress of human understanding about the delicate balance between intervention and restraint, between helping and harming, between medical ambition and medical wisdom. Tomorrow will bring new challenges, new opportunities to test the lessons you've learned about the nature of healing and the importance of trusting your body's innate wisdom. But tonight, there is only peace, rest, and the gentle satisfaction of having survived both illness and cure, of having learned profound lessons about the relationship between medicine and healing, and of drifting towards sleep with the knowledge that sometimes the best medicine is simply giving the body time and space to do what it knows how to do best, heal itself naturally and completely in its own perfect time.